A lot of our patients clench or grind their teeth. It is an extremely widespread problem, especially here in the United States, where we have so many type A personalities and where we have patients who really live stressful lives. So grinding or clenching your teeth is a way that we tend to cope with our stress and we're not even aware of it. Those forces on our teeth on a continual basis cause a fair amount of damage to the teeth, and even worse than that, can cause a fair amount of damage to the joint. The jaw joint functions differently than any other joint in the body. And it's not like you can run in and get a jaw replacement like you can get your hip replaced when you're 60 years old. So this is something that is incredibly important for us in our practice, to make sure that patients are getting the attention that they need if they have temporomandibular joint dysfunction. TMD is what this is technically called, the discomfort that people get in their joints. In the jaw joint, and whether that is just soreness that they get in the joint, or whether it's a clicking that they're getting in the joint, or whether they're getting locked open or locked shut, all of those symptoms are part of a much bigger problem. When I was at Harvard, one of the areas of my research was specifically on treating TMD, and there are a lot of ways to approach it. And so we take a very non-invasive approach to start, and gradually with time we increase as needed. So we usually will start with our patients using some type of appliance that they wear at night, a mouth guard, something that if they are clenching will keep the forces off of the teeth, something that if they're grinding will keep them from destroying the joint. In addition to that, there are some physical therapy techniques that I teach my patients to deal with it. And then if those aren't quite sufficient, then I also offer Botox in the office. For some people, that is really their only relief. But it's a fantastic relief. And if you inject a bit of Botox into specific spots in the jaw, it will cause those muscles to release. Now, it doesn't make you look like you've had a facelift or anything, and it doesn't paralyze your jaw so that you can't chew. You've still got complete function, but you don't have quite as much strength, and that will help to protect the teeth as well as to protect the jaw long term.